Stress is not just a psychological response. It also involves a physiological response, and that response has an impact on our health. There are a number of areas in which stress affects health, but we're going to talk about two of them: cardiovascular health and the effectiveness of our immune system. With respect to cardiovascular health, the type of personality seems to make a huge difference. Type A personality tends to respond more strongly to stressors in a way that affects the likelihood of cardiovascular disease. Type B, which is simply not type A, are individuals who do not show this strong response. The concept of type A behavior was first recognized not by psychologists, but by two cardiovascular doctors. They noticed that many of the people who had heart attacks in their practice were not people you would expect to have heart attacks. They did not appear to be fragile. If anything, they tended to be very strong and effective in their occupation and in their life. Specifically, they identified several characteristics for these individuals who seem to be at higher risk. As it turns out, only two characteristics, aggressiveness and time urgency, which are starred in this list, appear to be predictive of increased risk for heart disease. So type A behavior is one risk factor for heart disease. Stress contributes to that because it increases the likelihood of acting out the characteristics of type A behavior. But also poor coping skills and lack of social support increases the risk. If you are not able to cope well, stress goes on, and social support is one of the best buffers against stress. So these factors also contribute. Now that I've said that there are psychological risk factors and that stress plays a role, let me point out that in general, the role played by these factors is less than the role played by traditional biological factors. People who smoke, for example, have a much higher risk for heart disease. And if your LDL is high, you are more likely to have blockages that will lead to heart attacks. Obesity, lack of exercise, diabetes, especially if it's uncontrolled, and of course, genetic risk for disorder that shows up as a family history are all more strong risk factors than the psychological risk factors, including the level of stress. Stress also has a major impact on the immune system. Remember when we talked about the autonomic nervous system? When we are stressed, the sympathetic nervous system is active and the parasympathetic nervous system tends to be inactive. And the parasympathetic nervous system tends to take care of our bodies. Included in that is the immune system, which is vitally important to our health. The immune system is immensely complicated and affected by a variety of variables. But I'm only going to give you a 1-minute overview, so this is not a very good overview. What the immune system does is it protects us from invading organisms, things like viruses and bacteria and other things that could damage our body. It does that in a variety of ways. Macrophages, for example, is the first line of defense. Macrophages identify things that don't look like they're part of our body and destroy them quickly. But many things are not picked up by the macrophages and instead rely on a secondary line of defense called lymphocytes. We're going to make a distinction between B and T cells. T cells are often called the killer cells, and what they do is they destroy and remove invading organisms or cells that have been damaged, perhaps by such invading organisms. The B cells mark things for destruction. We call them antibodies. As I'm preparing these lectures right now, we are going through a serious situation with the COVID-19 virus. Those people who get the virus often get very sick, and their body produces antibodies which, in theory at least, will protect them from getting sick again. But what we're hoping for is a vaccine. The vaccine will stimulate the body to produce the antibodies to the COVID-19 virus. And therefore, if we are exposed to that virus, that virus will be immediately marked by the antibodies and destroyed by the T cells. You might be surprised to find out that cancer involves the immune system. Again, this is a bit of an oversimplification, but I want to give you an idea of how cancer is affected by the immune system. Cancerous cells are cells that have mutated so that they grow uncontrollably. You have tumors. Sometimes those tumors will break into small pieces and spread throughout the body, a process called metastasis. Once tumors metastasize, they're very hard to stop in the body. The tumor is caused by two separate shots to normal cells. The first one damages the DNA of the cell and makes the cell less functional. Typically, the immune system recognizes that, labels the cell, and then has the T cells destroy the cell and remove it. If, however, that cell is not destroyed and a second shot to the DNA of that cell happens, the cell may very well turn cancerous and grow uncontrollably. So if the immune system is functioning well, it typically gets rid of these dangerous cells that are precancerous before they can become cancerous. Now, what causes these cells to do it? Typically, it's external agents that we call carcinogenic agents. It could be cigarette smoke, or it could be too much sunshine, or a variety of chemicals. What happens is that the immune system that is attenuated by too much stress, or stress that is too constant, simply can't keep up with the normal carcinogenic effects that we're exposed to every day. Now, stress not only puts us at greater risk for a lot of diseases, including cancer, but having cancer is incredibly stressful. In fact, some people find it hard to even say the word out loud and will use euphemisms like the big C to talk about it. Think about it. If you were to get cancer, you probably are going to have a treatment that is terribly difficult. Chemotherapy is basically poisoning the patient to within an inch of their life, with the idea that the poison will be drawn into faster growing cells at a higher rate, and therefore may kill the cancer before it kills the person. One reason that your hair falls out when you have chemotherapy is that your hair grows very rapidly, and so it dies as a result of the chemotherapy. Imagine getting into the car to drive to the hospital to have chemotherapy, knowing that by the end of the day you are going to be vomiting and as sick as you can imagine. and that you'll have to keep doing that again and again until you're cured. What we know is that the stress associated with cancer treatment is enormous. And the advantage of reducing that stress using a variety of psychological interventions is very high. These two graphs are called survival curves. So what we're looking at is successful treatment, either with or without a psychological intervention designed to reduce the stress that one experiences from the treatment. So the further the line drops, the more relapse we see. The first graph is for general cancer. The second graph is for breast cancer specifically. What you see is a dramatic increase in survival in those individuals who got the same biological treatment, but either did or did not receive psychological treatment in addition. For example, you cut the death rate from breast cancer by more than 50% by including psychological treatment. Stress is not just an uncomfortable situation. It takes a toll on our body. When our body is fighting something as serious as cancer, that can be the difference between life and death. Now, there are a number of stress treatments that have been developed by psychologists. I'm going to give you only a brief orientation. Many of these we will talk about later in the course because they're helpful with a variety of psychological disorders. One is called progressive relaxation. You probably have told yourself at least once, just relax. And my guess is you discovered, well, that doesn't work very well. It's very hard to relax. Progressive relaxation relaxes you by having you relax your muscles. You can learn to control your muscles much better than you can learn to control this feeling of being tense. And if your muscles are relaxed, you feel relaxed. Biofeedback, which was very popular in the 1960s and 1970s, gives you information about how tense you are or how fast your heart is beating by measuring it electronically and converting that signal into something you can see or hear. That extra feedback can help you to relax, help you to slow your heart rate. But frankly, we've discovered that we don't need that feedback. We can teach people techniques that achieve the goal and have them focus on doing the technique. Stress inoculation is essentially teaching people to get used to stress. The more we experience stress, the better we are at handling it. And after a while, it doesn't have the same impact on us. Sometimes people will refer to this process as been there, done that. If you know you've experienced stress before and you've handled it, you have a confidence level that's higher. Meditation and exercise are both effective ways of reducing your stress. Meditation primarily because it involves relaxation, but also controlling your thoughts, focusing them elsewhere rather than on the stressors. And then cognitive behavioral therapy, specifically cognitive reappraisal, gets you to redefine the situation. Often, difficult situations, we look at them and we say, oh my God, I can't handle this. But in fact, there's usually good evidence that you can handle that. You need to challenge those feelings that this is beyond your control by pointing out that you've dealt with things like this before. At one time, we thought of stress in terms of the stressor. So the more stressors, the more powerful the stressors, the more stress people experience. But you don't have to study stress for very long before it becomes very clear that there's huge individual differences in how people respond to the same stressor. Now, there's a variety of reasons for that. Some of them may be biological and influenced by our genes. Others have to do with how we view the stress, which we call attributional styles. How we determine whether we will be able to handle it, whether the stress is our fault or the result of something outside of our control. And of course, the experience that you have in handling stress is going to affect the way you look at stressors. If you've handled stress in the past, you are going to be more convinced that you can handle the same stressors again. Our last topic is trauma-related disorders. Clearly, trauma-related disorders such as post-traumatic stress disorder or PTSD follow what we call a diathesis stress model. Some people are at greater risk even before they face a major trauma. But that risk will not affect them unless the trauma occurs as well. So you need both the risk factors plus the environmental event that is severe enough to trigger those risk factors. We'll talk about the risk factors in just a moment. Bereavement, which is the result of losing someone close to you, is a normal response and a stressor. But for some people, it is a stressor that is so powerful that it leads to trauma-related symptoms. An important point that we will be talking about throughout this course is that children are not just little adults. Children respond to the world differently than adults respond to the world. When a child experiences trauma and/or severe stress, their reactions are very different than what we see in adults. Typically, those reactions show up in the attachments to the people that are important to the child. Sometimes those attachments are damaged so that the child doesn't get the social support that they would normally have. Sometimes you see just the opposite, where the child seems to be so needy with respect to social support that they will approach anyone, even people who might be dangerous or potentially dangerous for that child. The pattern that we see in adults who experience severe trauma, and by severe trauma I mean life-threatening or potentially life-threatening trauma, is very different. First of all, if you are in a life-threatening situation as an adult, you are likely to show what we call acute stress disorder, which basically is post-traumatic stress disorder that lasts for only a few days or weeks, typically less than a month. If it goes on longer than that, the stress response tends to be far more chronic, and we call that post-traumatic stress disorder. The symptoms of post-traumatic and acute stress disorder will be covered shortly. Less severe trauma that requires a lot of effort on our part to deal with stressors can lead to what we call adjustment disorders, and they can range from relatively mild to rather severe in terms of affecting how well we can operate. Even positive things. You get a promotion at work. You're making more money. You have more prestige. You have more security. But you often find that you're making more mistakes than you ever did because A promotion requires an incredible number of new tasks, new responsibilities, new things to learn, and all of that is stressful. So what are the adult symptoms that we typically see with severe trauma? Often, there's an intense fear response when the trauma occurs that is relived over and over again. We experience it as nightmares while we're sleeping, or flashbacks that can feel incredibly real while we're awake. This often leads to a sense of helplessness because we don't feel like we can control it. And because the symptoms disrupt our performance, we often tend to remove ourselves from social situations that require that we adapt. It takes energy to be in a social situation. So we avoid it because we don't feel we can handle it. But by avoiding it, we're not getting the social support that is so important to our emotional health. It's also very common with PTSD, especially PTSD because it can be so chronic, for there to be secondary symptoms that may include things like depression or drug and alcohol abuse. The drug and alcohol abuse is often a self-medication strategy, but if you drink too much alcohol or take too much drugs, you very likely will create an addiction that creates another serious stressor for you. We know that one of the best predictors of PTSD symptoms, like the ones I just discussed, is how intense the trauma is and how close one is to the trauma. So, for example, on 9/11, our country was attacked. Those people who were part of that, perhaps in the Twin Towers, they experienced severe PTSD symptoms because their exposure to the trauma was very direct. Most of the people who were on Manhattan, close enough to hear and feel when the towers collapsed, they experienced severe trauma. In general, though, the further you got away from the actual attack, the less severe the trauma was, and the less likely that someone would develop PTSD symptoms. Again, this was a major trauma, and the fact that many people witnessed it live or nearly live on television meant that they had some fairly direct exposure. But not everyone developed PTSD, even those people who were very close to it. We know that there are biological factors that are genetically influenced. We know something about what they are, although that's fairly complex, and I'm not going to be going into it here in this lecture. But there are biological factors. And there are psychological factors as well. We've already talked about predictability and control as being very, very important. If you are in combat, you often know when there's going to be an attack and when there won't be an attack, when you're in a safe place. One of the reasons why we see so much more PTSD among soldiers now than we ever did from previous wars is that in previous wars you were in danger when you were at the front and not in danger when you were away from the front. Modern war is typically asymmetric. You might be killed by a soldier in a uniform 100 yards away in a firefight, but you might also be killed by reaching down and picking up a doll laying in the street that's actually an improvised explosive device that blows up in your face. This unpredictability and lack of control makes it far more likely that you'll see PTSD symptoms. And then finally, social support is an important buffer. I've said this before, I will repeat it throughout this course. Stress makes everything worse. Physical, psychological disorders are more common and more severe when people are facing a lot of stress. And social support makes everything better. Stress is not necessarily the cause, and social support is rarely the cure. But stress as an agent that makes things worse is generally true in almost every situation. And social support helps in almost every situation. The treatment of stress disorders usually rely on a variety of therapies that we typically refer to as cognitive behavioral therapies. Part of it is to teach you how to manage the stress better because, well, stress makes everything worse. So if you have a PTSD response, you need to be able to manage stress so that it doesn't trigger strong responses. You also want to desensitize people to the things that trigger those stress responses. And we do that through exposure. Whenever possible, we try to do that gradually, but sometimes the PTSD symptoms can be so severe that what happens is any exposure is going to lead to intense anxiety. And we call that flooding, the massive response. Now, we try to do as much treatment as possible during the acute phase of a trauma response. Because if we do not reduce the traumatic response during that phase, we tend to get a much more chronic and far more difficult to treat condition, the post-traumatic stress disorder. Let me briefly describe some of the psychological elements used in traditional cognitive behavioral therapy for a disorder like PTSD. Habituation refers to repeated exposure until we no longer respond the same way. This happens with just about everything. If you are in a large city and you grew up in a small town, you're likely to hear a lot of sirens, simply because, well, in a large city, more people get in accidents. The police are called, fire is called more often. You will hear those sirens. And you will respond to every one of them until you get used to it, until that becomes background noise. You can do the same thing through habituation to the things that are triggering stress responses. Cognitive restructuring is basically teaching yourself to say things that reduce your response. Like, yes, that was a siren, but no, I don't have to worry about that because sirens go off all the time. And usually it's something that's affecting other people but won't be affecting me. I'm going to come back to EMDR shortly. There are a variety of chemicals, medications, that reduce the stress response. They tend to be more effective during the acute phase, but they can work even in a post-traumatic stress disorder. And then, of course, we are aware that drug and alcohol addiction, depression, these kinds of things often follow from PTSD symptoms. They have to be treated as well because they won't go away if you reduce the PTSD symptoms. Now, coming back to EMDR, which stands for eye movement, desensitization, and reprocessing. It works like this. You think about the things that stressed you or traumatized you. And while you do that, you move your eyes in a particular pattern. And what that does is it rewires your brain so that you don't respond the same way. Now, if you believe that, I can come up with some really good investments where you can double your money overnight with no risk whatsoever. The theory is stupid. It's not only incorrect, it is so incorrect that no one with any understanding of how the brain works would accept it. But the treatment works. It works about as well as any other treatment, in some cases a little better. Now, it certainly doesn't work because it rewires the brain. But when we find something that works and we know it shouldn't, we have to ask ourselves, why does it work? In this case, probably what's happening is the individual is doing the exposure, and that creates an habituation process. That's the traditional way in which cognitive behavior therapy is used. And this focus on their eye movements distracts them from their stress response. And the more you pay attention to anxiety or stress, the worse it gets. So the distraction helps them to control it. And there's probably a placebo effect because the people believe they're rewiring their brain. All of those are legitimate effects. And it may very well be that in the therapies that have a better scientific basis for explaining how they work, maybe those therapies need a little more of the placebo effect or distraction effect that EMDR does. Again, the point here is that the disorder or the treatment for the disorder doesn't have to have a legitimate understanding of how it works, but sometimes the story of how it works can enhance a big part of all treatment, which is the placebo effect. So in summary, the autonomic nervous system is the primary mechanism for our stress response. And although our stress response is not comfortable, it actually prepares us to function at a higher level. And in that respect, it's a good response. But it has a price. When we have sympathetic nervous system activity, our immune system can be negatively affected, and therefore we can be at risk for a variety of disorders. If we are faced with an extreme stressor, what we'll call a trauma, something potentially life-threatening, the response can be much more severe. And if it's not treated effectively quickly, can become much more chronic, what we call post-traumatic stress disorder. We have treatments for post-traumatic stress disorder, but frankly, they don't work nearly as well as they would work if we had applied them right at the beginning when we first experienced the trauma.